Dr. Louis Teulieres. Since 20 years, I've been working in infectious diseases, chronic inflammatory diseases, immunological conditions. I was lucky enough to have been trained in these sciences at Pasteur Institute and having also worked in various university hospitals in France, in UK, and some scientific institutions in United States. Therapists and doctors which are dealing with chronic infections, bacterial infections, may face two kinds of difficulties. We have selected some tests for their specificity and sensitivity, and we have established a diagnostic, and also then, therefore, selected antibiotics accordingly. After a while, these antibiotics do not work, or the symptoms seem to be worse. Then the same antibiotic that didn't work begins to work again. It's a very strange phenomenon. Until now, we thought it was due to the fact that these bacteria could have cryptic forms and survivors also that could replicate again and multiply themselves, explaining the relapses. So we try to repeat the tests, and the tests also are very curious. They got even more positive, or they become negative or doubtful. Some bacterial co-infections appear. So we continue with antibiotics, and our poor patients receive months, weeks and months of antibiotics. And still the symptoms are there. I strongly invite you first to verify the diagnostic with the only test that can evidence the existence of living bacteria. That are the PCR, the direct PCR test, and the phage PCR tests. When you're dealing with Borrelia, Rickettsia, Miyamoto, relapsing fevers. And also to think about what is called now stealth viral adaptation. It's a strange and nasty cooperation between viruses and bacteria. Above all, when we are facing neurological conditions. Very common viruses, measles, Epstein-Barr, cytomegaloviruses, herpes 1, 2, 6, flu, COVID, enteroviruses are able to be neurotropic and create central neurological system and peripheral system inflammations. So I do invite you to think about it. In which consists this stealth adaptation? The virus penetrates the bacteria before crossing, for example, the blood-brain barrier. So it's a kind of a shuttle that crosses the barrier, which is recognized as a bacteria by the immune system. And once the barrier is crossed, the virus gets out and expresses its virulence. So it's not a bacteriophagic stage. The virus does not integrate inside the bacterial genome, and then after multiply many copies and destroy the bacteria to express itself in the neurological tissues. It's something different. Another kind of adaptation it's also that the virus penetrates the bacteria before crossing the barrier and goes out also before crossing the barrier, but taking with it some antigenic determinant of the bacteria. So it's kind of a hybrid entity that crossed the barrier, which is not a bacteria, which is not a virus, this is a victeria, something like that. And there also, the immune system is not very efficient. Strongly invite you to think about neurotropic viruses, stealth adaptation and cooperation with bacteria when you are facing this kind of problems. We know how to treat some viruses, herpes, flu, COVID. We have also plant-derived treatments, but I would like also to talk about what is called SOT, supportive oligonucleotides therapy. There are nucleotides that are able to block the replication of the virus and also from the bacteria. Of course, they need very, very precise and specific diagnostics, such as the phage PCR for the bacteria and other ones, the newest ones for the viruses. I hope I will go back to you and be able to talk about these future trends, and I hope to see you soon. Bye.